What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Halloween edition of the Pandemic Update for Halloween, October 31st, 2023. COVID? Yes, there are some tricks today in the news. No treats. I don't really have any treats for you. I got tricks, which is not good. Let's read a couple headlines. SARS-CoV-2 Omicron variant more common, tied to more severe outcomes than flu and RSV. So, for all those saying, oh, COVID is just like the common cold, it's just a that's COVID. No, it's more than that, and it's not the flu either. There's more severe outcomes in COVID than there are with flu and RSV. And quite frankly, there's still more deaths than there are with flu. All right, this is not good. This is another trick. That's not a good one. Study, regardless of variants, half of long COVID patients fail to improve after 18 months. Let's just read the start of this. We could actually do a whole video on these first two things. Maybe someday we will. We got a lot to get through today, so we won't. More than 50% of long COVID patients fail to improve 1.5 years after their initial diagnosis, according to a new study based on cases seen at a Danish post-COVID clinic before and after the Omicron variant period. The study was published yesterday in the International Journal of Infectious Diseases. So, yeah, that's bad news as well. And I thought I had up here, but there was a senator today that did test positive in North Carolina. I believe it's a Thomas Tills, who's the Republican senator out of North Carolina. I don't see that added in my tabs, but I will be adding that to the website. Believe it or not, I just tweeted that just a few moments ago. All right, now let's go up to Iowa. Iowa HHS announces first flu death of the season. So we saw one of the Dakota states recently report a flu death. Now Iowa has their first death. And there's probably others out there. We're just not hearing about them. I'm sure there's been other flu deaths out there in the United States. And we're just not hearing about all the states that have reported them because, you know, in places of slow news like Iowa, maybe it's a slow news day or whatever, they'll include that there's a flu death. And other places like a major city where there's endless news, you're probably not hearing about there being the first flu deaths. At least I don't think so, but hey, I'll keep searching. Alrighty, I did a poll question last night, and I've done many of poll questions before. I think this one had more votes than the majority of the polls I've ever done in the past. I don't know if this is number one, but it's up there. It's at least top 5 for number of votes. And I asked just a simple question. Has the COVID pandemic changed your life? And I said I may use some comments in the next edition of the Pandemic Update. 97.9% say yes. And just a mere small, teeny tiny 2.1% said no. So, yeah, the vast majority said yes. Let's just read a few comments. We're not going to read them all. There's 91 to be exact. Let's just read a few comments. First off, username Long COVID Hell puts, at age 39, healthy and living my life to the fullest with my family. A COVID infection in March 2020 left me with organ damage. I'm still not recovered. I've lost my career, lost friends and family, and my faith in healthcare and humanity has been shattered. Wow. I am so sorry to hear that. So that would be definitely, yes, COVID has changed your life. Justin Asair put, where to begin? LOL. Yeah. I mean, for some of us, I mean, it's changed big time. Let's just keep coming down. How about he who? Or he ho, I should say. Yes, I'm now more aware than ever about how public health works and just how cruel people are willing to be normal. Yeah. I read about the scurry to return to normal after wars in high school, but it's completely different experiencing it in real life. Yes. How about this one? This one, Can12312 put, it's like I aged 20 years in the span of a few months. We could sit here reading comments all days. I get it. It has changed a ton of people's lives. 97.9%, once again, said yes out of 1,748 votes. That's a lot of votes. That's a statement right there, in my opinion. All right, let's continue on. Before we get to the air quality, we're always talking about, as of lately, about bad air quality out on the West Coast. Well, this could be one of the reasons. Southern California wildfires forces 4,000 residents to evacuate homes. And speaking of that, let's take a look at air qualities. Taking a look at air qualities here, you can see here, it'll come up eventually. Yeah, the West Coast, look at that. It's actually getting worse. This is not good at all. Really bad in California, extremely bad in Oregon, Washington, and even portions of Idaho and Montana. Please, if you have to go outside in these areas, mask up. We also have some bad, poor air qualities ongoing right now in Michigan. Not certain what that's all about. Is it because there's some moisture in the air? There's a system that's going through there? And then we see a little stretch along the Georgia Atlantic coast and South Carolina Atlantic coast, a stretch of bad air qualities as well. The Northeast is not doing too bad. A little bit here, where is this? South Central Pennsylvania. Not certain what that's all about either. Let's take a look at heat-related illnesses. You can see not bad. Still some in Florida, still some in the Southwest and Texas. Isolated in North Carolina. Also, just one county in Maine that's still a problem. Alrighty, let's take a look at a few of those Walgreens sites that we did not look at yesterday. National positivity trend is 27.3%. The prior week was 26%. It's a difference of up 1.3%. 11,752 total tests. The prior week was 11,994. Let's take a look at a couple states. Here we go. Maine this week is coming in with 18.8% positivity, 25.8% the prior week. Difference of down 7.1%. One test higher at 32 versus 31. That's a legitimate drop. Your neighbors up in New Hampshire report 35.7% this week, 34.2% last week. Difference of 1.5%. Total test is 28 versus 38. So testing is down, and that's why your positivity rate is rising. Vermont, not so good. 18.2% this week, 10% last week. That's up by 8.2%. Total test, 11 versus 10. So yes, that is a legitimate rise. Massachusetts, 24.1% positivity this week. Prior week was 31.6%. Difference of down 7.4%. Total test, 29 versus 38. Testing's down, but positivity's down. It's a legitimate drop. New Jersey, what's going on in the state of New Jersey? We see that the positivity is 28.9%. The prior week was 22.9%. It is up by 5.9% in New Jersey. However, testing is down quite a bit. 357 versus 441. It's simply a product of testing. Connecticut is 24.7% this week, 15.2% last week. Difference of up 9.5%. 93 versus 92 test. Yes, that's a legitimate rise. What's going on down in Florida? 21.2% this week. Prior week was 21.4%. Difference of down 0.2%. Total test, 1,342. Prior week was 1,375. I'm seeing some green in Alabama. That's usually a good thing. Current week, 17.3%. The prior week was 25.9%. That's down by 8.6%. And total test, 127 versus 85. So testing is up. Wisconsin this week is 30.3%. The prior week was 30.9%. That's a difference of up 2.5%. And testing is also up as well. 327 versus 298. Yes, that is a legitimate rise. How about West Virginia? West Virginia this week, 19%. The prior week was 8%. Up 11%. 42 tests versus 25. That's a legitimate rise. Alrighty, moving on. We could do more states, but we do have some other things to get to. Let's take a look at the latest variants. HV.1 leads nationally at 25.2%. EG.5 then comes in at 21.9%. FL151 is at 12%. Alright, taking a look at hospital admissions in the past week, 16,186. Now coming down to Philadelphia. Philadelphia had 799 EMS incidents yesterday. That's not a good number. That's just one shy of 800. I don't like going over 800. That is far too high. Let's do a live look in at what's going on in the suburbs right now. We can see, look at this. Montgomery County's not that busy at all. How about what's going on in Chester County, Pennsylvania? Sometimes we see the opposite there. And in this case, we do. Wow. Look how many sick person calls. Not one, not two, not three, but four different sick person calls. I'm seeing stroke. I'm seeing heart problems. Yeah, it's a busy time right now in Chester County, unlike Montgomery County. And look at this. One of these is actually for Lancaster City, which is a different county. So they actually have to go out to Lancaster, Pennsylvania. You know, Amish country. Yeah, yikes, that's not good. Now let's go across the Delaware River to New Jersey. If you notice, we're doing this a little bit different order today. I think it makes more sense that we stop in New Jersey, then go up to New York State. Hospitalizations in New Jersey, 471. 18 people on a ventilator. 51 people in the ICU. And let's take a look at discharges. 46 people have been discharged. So again, let's go back to this hospitalization number real quickly. It is higher. Yesterday and today is a little higher than it was over the weekend. 68 out of 70 hospitals are reporting. New York State started the new week today. And 925 new cases. And look at this. Yes, hospitalizations are up slightly. 1,281 versus 1,256. But the overall trend, I gotta say, it's down again. That's a good thing. All right, tomorrow will be Wednesday. On Wednesdays, we usually get the new numbers out of Texas. And right now, let's take a look at a few international numbers. I'm going to tell you right now, to be honest with you, some of these numbers are incorrect. Australia, very well, could be incorrect. I'll explain in a moment. Russia, cases up 18%, deaths up 16%. Germany, cases up 30%, deaths up 18%. Italy, cases, it's saying down 59%, down 73%. I'm not 100% certain that's true. I believe we're seeing JN.1 start to increase there. So that's one country I would err on the side of caution. New Zealand, cases up 2%. And deaths up 75%, 42 versus 24. Australia, it says down 34% and down 64%. However, I just read an article stating that Melbourne is starting to see a significant rise in cases. Now, that is Melbourne, and maybe that doesn't reflect what's happening across the rest of the country, but you have to wonder sometimes. I mean, sometimes I read articles that state things that are different than what's being reported at Worldometers, and wow, this is not good. 56% increase in cases in Poland, 163% increase in deaths. That's 21 deaths versus 8. Not good to see. Bulgaria, 0.2% decrease in cases. However, deaths are up 94%, 31 versus 16. Let's quickly also take a look at flu data. We talked about there being the first flu death in Iowa. It's still coming in at minimal. So even if you're in the shade of minimal, don't assume, oh, well, it's minimal here, there's no flu. That's not true. Iowa had its first flu case, or flu death, I should say, not case. So if there's a flu death, that means there are cases out there. So be vigilant. Alaska's at high flu activity. Puerto Rico's moderate. Florida is moderate. New Mexico is moderate. Wyoming's low, but it's approaching moderate. We're also seeing moderate in District of Columbia. And then we are seeing a lot of other places that are low, but, maybe going to switch over to moderate pretty soon. Alrighty, that's all I have for today's pandemic update. Given it is Halloween today, I hope you have a spooktacular evening, but I hope you do it safely. I hope you choose to wear masks. And I mean N95 mask, not a Halloweeny mask, N95 mask. If you're going to be dealing with trick-or-treaters, please mask up. It's very important. There could be a lot of spread going on tonight, so it's important that you mask up. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this content, by all means share this with them. The more you guys share these videos, the more you thumbs up, the better chance we have of hitting the algorithm. And the whole point behind that is getting more people to view this so we can get the message out there that, hey, the pandemic is not over. I have convinced many of people so far since I started this channel, but not good enough. I need to convince far more people so we can get more people to start masking again so we can help prevent the spread of COVID. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic evening. Thanks for watching.